Hello everyone, this is Dr. May. I'm coming from the Martin Center. I got a lot of questions recently about different types of rhinoplasty techniques and what kind of techniques I like to use for a lot of my patients. I have a patient who recently had surgery and agreed to allow us to use her photos for education, and I thought this would be a great time to kind of go over those different techniques and what kind of outcomes people can look forward to. The first thing you notice on this patient on the left-hand side is if you look at my mouse cursor, there's a dorsal bump here, kind of where my cursor is located, which kind of gives the nose a downturned look. The tip of the nose is what we call ptotic, is where when it kind of falls down towards the upper lip. The nostril here is slightly arched, and so kind of giving more appearance in that lateral view. And then the next thing is the upper lip is slightly on the longer side. And kind of gives us an overall appearance of like kind of a droopy nasal tip. And that's some of the things that bother this patient the most. To address those concerns, I like to do something called dorsal preservation. The best way I can describe it is imagine you have a tripod and you have 3 legs to it. And traditional techniques, like say you have a dorsal bump on your nose, the top of the tripod, the kind of the peak area, traditionally, you just kind of like chop off the top part and then it's kind of left flat with your tripod. And so to make it more round, you have to bend the legs in or create nasal fractures to make that more rounded. And so that's what we traditionally do. And some people still do that, and it's a great technique. It gives really good results, tried and true. However, there's another technique called dorsal preservation. And so instead of, cutting off or chopping off the top part of the tripod, imagine if you take little pieces off from each of the 3 legs. And instead of it being flat on the top part is preserved. And then everything just kind of sits lower. And that's what I like to do for my cases in terms of a dorsal bump. And so you kind of see in this view, the dorsum is much straighter compared to before. And it's very natural. You don't see any lumpy, bumpy areas. It's not super curved. It's very straight and in my opinion, a very nice, elegant appearing look that will be tried and true for many, many years to come. The next part of the nose is the tip of the nose. I had to rotate the tip up just a little bit so it's not so, kind of have that fallen down look, which you kind of see here. I lowered her nostril just slightly, just so it's a more natural look to it. And you don't see so much shadowing here as you see prior. And then the last thing is the upper lip. So you can see in this photo that the upper lip is much shorter compared to prior to surgery. And this is a technique that is probably not used by a lot of surgeons at this point. This is a technique that my mentor and I, Dr. Dean Torimi, kind of pioneered in a way to shorten the upper lip through a rhinoplasty surgery. And so lip shortening surgeries have been around for decades, but they usually include making a scar on the underside of the nose, which kind of gives a bad appearance of the nose. And so what we kind of designed during my fellowship with him is that you can do undermining and dissection in this part of the nose and then lift this up to about this point, which will shorten the upper lip, is what you kind of see here. And it kind of gives it from a sharp angle to more of a curvy, linear position compared to prior to surgery. And that's a very feminine look. A longer upper lip is a sign of aging. And as we get older, that upper lip will get longer as we get older, and which is just part of the process. But if we can make it appear slightly shorter by making it more curved, it's a more youthful appearance, a more feminine appearance, which kind of just helps this patient's overall aesthetic profile picture. The technique that I like to use for dorsal preservation, there's probably anywhere from 10 plus different techniques, and I've been trained in a lot of those different techniques, but one of them that I think is very powerful is one of the ones that I think worked really well in this patient. Is called the Tetris technique, and this technique was pioneered by a rhinoplasty and facial plastic surgeon in Europe, Dr. Jose Carlos Neves, who's just a tremendous and great surgeon, and he published his technique a couple of years ago, and I'll show you how that looks. This is called the Tetris technique, and it's called a Tetris because it's almost like playing a game of Tetris where you make a shape in the septum to help bring down that dorsal hump, and kind of fits together almost like Tetris blocks. And so this is what this looks like. And so this gray area is part of the septum that's removed, and this kind of blue area is the space that will be collapsing. So you make a little kind of rectangular shape, and the septum goes from being elevated from a dorsal hump to being flat. And so that allows the dorsal hump to be reduced in a much more preserved way, where you don't have to make all these extra cuts in the nose, which lead to swelling and more bruising and just a longer recovery. And this is how you mobilize the nasal bones. When you do precision cuts in the bones, allow everything to be kind of a little bit smaller. And this is that technique called a Tetris technique that was pioneered by Dr. Jose Carlos Neves, that I think gives us such an elegant and very natural rhinoplasty appearance. So going back to our patient here, just to kind of summarize, the dorsal preservation technique is such a great technique to provide natural, elegant results while minimizing trauma to the other structures of the nose, which reduces swelling, reduces bruising, and just gives a very nice, natural look is what I really like about it. And so it's really good for reducing dorsal humps. You can use preservation techniques for the nasal tip. And then we talked about that advanced technique for shortening the upper lip through the rhinoplasty approach.